Hello everyone. Today's lecture is about dental records, documentation, consent, and referral. The outline of this lecture will be about dental records, documentation, consent, and referral. First of all, we have to know why we make and retain records. The patient record provides all parties with history and details of the patient assessment, communication between the dentist and patient, specific treatment recommendations, alternatives, risks, and care provided, the cost of the treatment provided, consent from the patient. Also, it assists with complaint resolution, medical, legal, and professional standards reviews, documenting compliance with insurer, other third-party payer, and government-subsidized individuals, and also we keep records for forensic purposes. Documentation is important for professional, ethical, and legal reasons. That complete chart and record of all aspects of each patient's dental care must be maintained. These records must be well organized, legible, readily accessible, and understandable. What constitutes the records? Accurate patient details and completed medical history, clinical notes made by the clinician and the staff, any consent documents, copies of correspondence about and with the patient, radiographs, charts, tracings, measurements done for the patient, images, reports, and casts, special tests, examination findings, photographs, and records of financial transactions. So, in order to summarize the contents of dental record, we will talk about patient details, substitute decision maker, consents and restrictions on disclosure, practitioner details, and clinical details. So first of all, we start with patient details. Such details including full name, the gender of the patient, the date of birth and address, email and telephone number for communication. Also, the current medical history of the patient, including any adverse drug reactions or any drugs taken by the patient. If the patient cannot make a decision, the dental record should contain the name, address, and contact details of the parent, guardian, or substitute decision maker and the relationship to the patient. Also include a record of consents provided by the patient. We will talk more about consents, but if a written consent is provided, the signed consent form should be included. Also, if a verbal consent was provided, a description of the treatment as explained to the patient must be included in the record. Advices given to patient on the treatment options, relative risks and benefits of those options, pre and post treatment instructions and the outcomes, all of this must be also written in the record. Also, any relevant questions, comments, or concerns expressed by the patient must be also included. If the patient doesn't accept the treatment, this must be also written. After the treatment, any comments or complaints by the patient must be also recorded, and if there are any restrictions on disclosure, for example, if the patient has made a direction in relation to care, such as refused to do blood transfusions or refused to provide any information, also this must be included in the record. Here we come to the core of the patient record, which is the clinical details. For each appointment, clear documentation should describe the date of the visit, the details of the practitioner providing the treatment, information about the type of examination, the presence of a complaint or the chief complaint of the patient, the relevant history at that visit, the clinical findings and observations, the diagnosis at that visit, and the treatment plans and alternatives, the procedures conducted, if any medicine was prescribed or administered during the procedure. We write also the name, the quantity, the dose, the instructions, and any advices provided for the patient at that specific visit. The clinical details should also contain unusual results of treatment, significant events or adverse events, radiographs if taken, and any other relevant diagnostic data such as digital radiographs, instructions and communications with laboratories, referral letters, and quotation fees, and also if the patient failed to attend the treatment, this must be written in the notes. The extent of details vary from patient to patient, and this depends on the conditions with which the patient presents and also the complexity of the treatment done or required. However, there must be certain baseline data that should be common to all dental patients and must be written in the dental record. The records must be accurate and concise information written. Also, it must be made in a chronological order, which means the sequence of events must be written down. So if you start with examination, write examination first, caries discovered, local anesthesia given, cavity drilled, and so on. Also, if abbreviations used, these abbreviations must be standard, so anyone who reads these notes must understand those abbreviations. And only clinical relevant information be written in the record. These records must be completed as soon as the service has been delivered by the dentist. So you should not wait to the end of the clinic to write the records. Also, third parties must understand these records, such as other healthcare providers. The records must be retrievable when required. All comments must be based upon facts. No emotional language must be used. The dentist must not delegate the responsibility for patient to any other person. So the dentist should do this on his own, by himself. The dentist also should ensure that only authorized and qualified information from the dental record to patients and other persons upon request should protect the privacy and confidentiality of dental records and compliance laws. Now, how and what to document? We can make charts of teeth, consent from patients, clinical notes, photographs, radiographs, and videos of the patients. All these things can be documented in the patient record. An important part of the record is the progress note, which is an entry that is made in the patient's record which accurately and objectively summarizes each visit. The entry must minimally contain the following information: the date and time of the visit, the reason and the chief complaint of the visit, radiographic exposures and interpretations if any radiographs were done, treatment rendered including the type and dosage of anesthetic agents, any medications, if nitrous oxide was given to the patient, the type and duration of protective stabilization. Also, post-operative instructions must be documented in the progress notes for each visit. The progress notes should also document any changes in the medical history in 6 month period. Also, if there is an adult accompanying the child patient, also reference to supplemental documents given to patient, behavior of the patient, and also the follow-up if any follow-up visits are scheduled for the patient. The ATEN system, A for assessment, T for treatment provided, E for evaluation of the treatment given, and the patient perspectives about the treatment, and N for what to do in the next visit. This is an example of a progress note written for a patient who came for the clinic. The patient presented for treatment of occlusal caries. The treatment provided, we write in a chronological order, as we said, mandibular block given, the quantity and concentration of anesthesia also written down, if rubber dam was used, the tooth number which was treated, what was done in that visit, caries removal, materials used for the restoration, and then evaluation. What was the patient behavior, how were the caries, how was the cavity preparation, was there any need for endodontic therapy, and also for the next visit what to do or what the patient expects from the first visit. If corrections and deletions to be done on the original record, striking out the incorrect words and rewriting the correct words on the document. And if the document is being rewritten, the original document must be kept as a reference. Liquid paper or erasable pens should not be used, so this is to keep the original document as it is without any modifications. Any amendments to dental records after they've been initially generated should be clearly recorded and dated, and corrections to these clinical information should not remove the original information from the record. Now, what makes these information special? Because the information about patient must be confidential. So there is a trust that these information are only for the dentist to be used for healthcare. Also, these information are sensitive, so any information or details about the individual body or lifestyle or practices are very sensitive and they must not be disclosed or misused. Also, there is a certain duration for retention of information, so if it's to be used after the treatment has been ended. So originally, dental records should be used and disclosed for two purposes. The primary purpose is to treat patients and to take care of patients. Also, the secondary purpose is to be used under privacy laws for billing purposes or if you are provided with a court order. These records containing identifying personal information and they should not be used for research purposes without the consent of the patient. So if these data from patients are to be used for research purposes, consent must be obtained and written in the research paper that consents were obtained from patients. The dental records must be protected because, as we said, there are personal information and these information must be held from misuse and loss or from any unauthorized access or modification to these records or disclosure. These records or files must be kept and locked in a room which is not accessible to the general public. All computers must be password protected and the dentist should ensure that these records are maintained on durable paper and the photographs should not fade with time and these must be copied. The record can be sent by secure fax or email and there should be methods to track these records such as registered mail or express post. And if the health record is destroyed after the required retention period, it must be destroyed in a secure manner, such as shredding of documents. The time for retention of records depends on the age of the patient. So the health information from an adult is retained for at least 7 years. But if the patient was under the age of 18, at least until the individual has attended the age of 25 years. Okay, and you can read the rest of these information. What are the legal implications of dental records? The dental chart is considered a legal document and it's the first line of defense if there is a malpractice suit in the court. Be aware of record alterations, and as we said, if any amendments or any corrections of the record, the original document must be always kept and maintained, because a poorly written or inadequate narrative about the patient could be the most damaging evidence against the clinician if there was a malpractice case in the court. In Jordan University Hospital, undergraduate and postgraduate students and specialty clinics have certain dental records. As we said, accurate record keeping is essential to ensure the continuity of patient care and to meet legal requirements. And the retention period for records in the Jordan University Hospital is for 10 years. At Jordan University Hospital, we use electronic records. The principles applying to written records also apply to electronic records. So, electronic records must provide prompt access to information and should be regularly backed up. Also, the records should be time logged, and if codes are used, they should be readily convertible to conventional language, and the dental practitioner must show who made each entry and when it was made, and there should be security procedures such as password only access to help secure the records. Please refer to the link in this slide for the electronic system used at Jordan University Hospital student dental clinics and which you will be using next 2 years. If the dental practice is closed, the dentist must notify patients in advance and facilitate the transfer of care for current patients to other practitioners, and the dentist must make appropriate arrangements for the retention and storage of patient records. This is the dentist's responsibility. An important topic to talk about is the consent. Patients must make well-informed decision about the treatment procedures, and it's the role of the dental practitioner to help patients to make these decisions. The consent may be of 3 types: implied consent, verbal consent, and written consent. Implied consent is obtained when the patient sits in the dental chair for any non-invasive examination procedure. Verbal consent is required when any invasive technique such as blood tests or cavity drilling are required to be done for the patient. The consents in such way are obtained verbally after explaining the need for the procedure to be done. Verbal consent is acceptable for simple general dental care and should be documented in the records. Written consent must be obtained for more complex treatments or treatments which involve significant risks or adverse effects. All patients having operations must write a consent, and all minors and in cases of adult guardianship. The consent is achieved by asking the patient to sign a copy of the printout of the treatment plan, and for this consent to be valid, patients must receive sufficient information about the condition and the proposed treatment. This written consent is called the informed consent. For consent to be obtained, the patient must have the capacity to consent. Some patients may be considered having no capacity if they are below 16 years, if they are mentally ill, if they have intellectual inabilities, or if they are affected by drugs or taking alcohol. In the case of minors or other persons with legal disability, the consent of the parent, guardian, or adult guardian should be obtained and recorded in the records. Before giving consent, the patient must understand the implications of the treatment, the materials used, the time of the treatment, the outcome of the treatment, possible complications, the degree of probability of a risk arising, the seriousness of possible injury, and cost. And also the patient must understand other alternative treatment options, including undertaking no treatment option. Also, the patient must give the consent freely, not under stress. Therefore, no treatment should ever be undertaken without giving the patient the opportunity to ask questions or raise any concerns or fears about the treatment. These are the details of information the patient must be given before obtaining a consent from the patient, and these details must be provided to the patient in order to be able to assess the procedure and give his full acceptance of treatment. What is the best time to obtain the consent? So, in order that patients understand they may be treated by students under supervision, the consent or even verbal consent must be obtained at the first appointment. Further, this consent establishes that de-identified information or teeth extracted as part of their care may be used for education and research purposes. It should be noted that this is a general consent. Further information may need to be provided, and a written consent should be sorted under ethics guidelines for research projects. Once the investigations are complete, the patient is entitled to advice on diagnosis and treatment plan, and the patients cannot properly consider treatment options if they are not given information or prognosis. So you should give all information to the patient and then you ask for their consent. Otherwise, they have nothing to put their consent on. If the patient is receiving a treatment under general anesthesia or under sedation, the patient is temporarily deprived of their capacity to give a valid consent to treatment. So it's undesirable for the consent process to be carried out immediately before administration of anesthesia or sedation, and the consent process should take place at a visit before the visit scheduled for anesthesia or sedation. The last part of the lecture is about referrals. The general dentist may refer patients to other dentists or to a dental specialist. This is depending on the dentist's experience or some patient-related factors such as age, cooperation of the patient, anxiety status, medical and risk factors, or because the case is complex, or the disease is severe, or the patient is not responsive, or there is a multidisciplinary plan for the patient care. The key information to include in a referral letter are patient information, gender, date of birth, address, and phone numbers, medical history, social history of the patient, the dental history of the patient. Also, you write your name and address and phone number to facilitate communication with the other specialists, and what you need this referral for, either for diagnosis or for treatment planning or for consultation, to return the patient or to refer the patient to finish the treatment. Is this an urgent referral or a routine referral? And you can include radiographs or any special tests done for the patient that can help the specialist to assess the case. This is a sample of a referral letter where you can fill in your information and the patient information and the purpose of referral, as we said, and keep the referral letter professional. No need to make it personal.